So welcome to my presentation on the therapeutic effects of interactions with dogs and other companion animals on the mental and physical abilities of people with dementia. So first we'll just explore the symptoms of dementia. So the most renowned symptom is that of memory loss, and this can cause a person to forget experiences, skills and people. People with dementia may also experience a change in behaviour, such as losing their inhibitions. This can cause them to act inappropriately. Aggression, both verbal and physical, is also common amongst those with dementia, and this can be difficult for family and carers. Dementia may also cause wandering, which is where people walk about, most commonly from one location to another, but without telling anyone, and this is potentially very dangerous for them. However, in the later stages of dementia, an individual's mobility may reduce significantly, or they may be reluctant to move from one spot. So, dogs and other companion animals can be used in an animal-assisted intervention for those with dementia. The concept of an animal-assisted intervention can be split into two separate groups. So the first is an animal-assisted activity. This is a motivational and recreational intervention that is used to improve quality of life. The other is an animal-assisted therapy. So this is more structured and is a goal-directed intervention, and the outcomes are documented, measured and evaluated. Animal-assisted interventions for dementia have been documented since the 1990s, and animals used can include dogs, cats and even more exotic species such as fish or reptiles. When used in dementia care, animal-assisted interventions utilise the human-animal bond to reduce behavioural and psychological symptoms. So numerous studies have investigated the benefits of animal-assisted interventions on the behavioural side of dementia. Firstly, Congerball et al. Found that a therapy dog increased a patient's social behaviours, such as smiling, laughing and verbalisation. However, a criticism of this study is that it has a small sample size consisting of only 12 participants. Nonetheless, another study conducted by Burnaby et al. Supports Congerball's findings and states that the presence of a dog stimulates patients to interact, thus reducing their social isolation and loneliness. Burnaby's study can be considered fairly reliable as it included the review of 18 journal articles on animal-assisted interventions and dementia. However, each of these studies may have had their own limitations, which could have been overlooked by Burnaby in his review. Furthermore, Marcello et al. Study in an Alzheimer daycare centre found that animal-assisted activities contributed to significant emotional changes, including increased alertness and pleasure. They also reported a decrease in sadness compared to the control group. Similarly, Klimova et al. Found that therapy dogs reduce patients' feelings of depression. This is a significant therapeutic effect and is advantageous for the patient's well-being and quality of life. On the other hand, Magic et al. Found that the symptoms of agitation and aggression in nursing home patients with dementia who received an animal-assisted therapy did not change over a 10-week period. However, those symptoms did increase over the same period of time in the control group, thus indicating that animal-assisted therapy may delay progression of behavioural changes due to dementia. However, it can be difficult to accurately label these studies as reliable because the data gathered is mostly qualitative. This means it relies upon people's personal feelings and experiences, and this cannot be measured. Animal-assisted interventions can also hold benefits for the physical symptoms of dementia. For example, it has the potential to decrease an older individual's blood pressure. Cherniak and Cherniak found that individuals who spoke in the presence of a dog had significantly lower diastolic blood pressure than those who spoke in the absence of a dog. Such data can be considered reliable because measuring blood pressure is quantitative. Additionally, Edwards and Beck utilised fish instead of the commonly used dog in order to see their effects on dementia patients' physical well-being. they found that residents successfully gained weight when fish tanks were installed in their recreational and dining areas. It can be difficult to encourage dementia patients to eat and therefore receive adequate nutrition, and so this study is exceptionally beneficial for their physical welfare. Edwards and Beck conducted this study with 62 participants. Now, while this sample size may seem small, the participants came from over 3 different nursing homes, therefore making it fairly representative. Furthermore, in regards to locomotion, Olsen et al. Found that animal-assisted activities with a dog had a significant effect on improving dementia patients' balance and preventing risks of falls. This is because patients were encouraged to bend down to pick up the ball, to throw for the dog, and also lean forward to pet the dog. So all of this contributes to improved posture control. Lastly, Lust et al. Found that multiple visits with a therapy dog had the ability to reduce medication usage in older individuals with dementia. Such medications included painkillers, psychoactive medications, and laxatives. So this shows that the presence of a dog has caused a significant improvement to their physical well-being, that they no longer feel the need to take these medications. So there is a range of organisations both in the UK and around the world that offer animal-assisted interventions. So in the UK, Pets as Therapy volunteers visit a range of establishments, including residential homes and hospices. So their volunteers are made up of regular people who wish to contribute to society through their pets. For this reason, it can be considered an animal-assisted activity. The animals used with this organisation is primarily cats and dogs, which must pass a temperament test before attending visits. Another organisation based in the UK is Dogs for Good. This is a large organisation that conducts numerous projects regarding animal-assisted interventions. For example, they have a Dementia Dog Community Programme, which runs animal-assisted interventions for events for carers and those with dementia, as well as a Dementia Dog project in collaboration with Alzheimer's Scotland. Animal-assisted interventions for dementia appear to be popular worldwide, with numerous countries having similar organisations. For example, India has the Animal Angels Foundation, and a number of Asian countries have Animals Asia Dog-to-Dog programme. So this animal-assisted therapy utilises dogs and is active in China, Japan, Taiwan, and Malaysia. Furthermore, the USA even has specialised Alzheimer's and dementia facilities. One such facility, called Lakeview Ranch in Minnesota, regularly conducts animal-assisted interventions for their residents, making it a unique establishment. They conduct animal-assisted interventions with dogs as well as small farm animals to improve 3 areas for their residents. So these include range of motion, emotional and mental well-being, and socialisation. In the informative video clip about the ranch, the head of the facility states that the presence of a therapy dog can help residents with their memory, as it may provoke them to reminisce about their past. While further research needs to be done in order to further understand the significance of animal-assisted interventions and their effect on cognition and memory, this comment can still be considered a significant observation. As animal-assisted interventions utilise animals in a way that can be considered unnatural, it is important to consider their ethical and welfare implications. It would be feasible to assume that the dogs and other animals used experience some levels of stress in these interactions, as they must undergo transportation, experience pets and hugs from unfamiliar humans, and possibly work for long hours. In the case of dementia patients, their unpredictability may also pose an additional risk for animals. Furthermore, Serpil et al. Argue that denying animals control over their physical and social environment can have adverse effects on their physical and mental well-being. It is important to note that there is no specific legislation for animals used in animal-assisted interventions. This can be considered disadvantageous for the animals used. in this way, as there is no official protection from harm or long days' work. Unfortunately, in the UK we have the 2006 Animal Welfare Act and the 5 welfare needs that must be adhered to. This can be considered advantageous for animal welfare. However, it is difficult to say how this would translate into a therapy animal's role when they are working. So there is also the argument of whether it is ethical to use animals in this way in an animal-assisted intervention. So for this reason, Simonata et al. Argues that we should implement the 3 R's which are commonly found in scientific research and implement them into the world of animal-assisted interventions. So these include replacement, reduction, and refinement. So replacement includes replacing the real animals with robots and soft toys. However, it can be argued that these substitutes lack the ability to read human body language and initiate interactions. Furthermore, people may be reluctant to interact with robots due to their unfamiliarity. So this could be particularly true with older individuals and those with dementia. On the other hand, Park et al. Found that an interaction with a robotic seal had a positive impact on depression and psychological agitation in older people with dementia. So, carrying on, reduction involves lowering the number of animals used in an interaction. So some people may take multiple small animals, multiple dogs, along to an interaction. So this just includes minimising that to the lowest number possible to have an effective interaction. And so lastly, refinement involves minimising stress and enhancing the welfare of the animals used. This includes paying close attention to the environmental conditions in which the interaction takes place. So loud noises, strong odours and the presence of other animals can induce stress as well as interrupt the interaction. Furthermore, animal-friendly equipment should be used. So this includes stuff like harnesses and so just equipment that can't cause any harm to the animal, especially during interactions where the resident may handle the animal, like walking the dog. And finally, professionals conducting animal-assisted interventions should respect animal life stages. So puppies, females in oestrus, pregnant females and lactating females should be excluded from animal-assisted interventions. So finally, the conclusions that can be made about animal-assisted interventions for those with dementia is that it is effective at reducing the negative mental and physical symptoms of dementia, and as a result, the individual's quality of life is improved. However, like I previously mentioned, a lot of the research is qualitative and therefore further studies should be carried out. So in terms of recommendations for future developments, I can recommend 2. Firstly, there should be more studies investigating the effects of structured and tailored therapy sessions for specific individuals to further explore the effects. I say this because a lot of the studies that we've looked at during this presentation have included the presence of the dog on a group of people rather than specific case studies. They're also more concerned with the individual's emotional well-being and quality of life rather than their overall physical and cognitive condition. Additionally, studies could also investigate the use of different types of animals on dementia. So a lot of the studies, again, have focused on dogs, with the exception being Edward and Beck about fish. So it'd be interesting to see if different animals such as cats, small mammals and reptiles have similar therapeutic effects. So the reason I say this is because the Lakeview Ranch in the US, as mentioned, utilises small farm animals as well as dogs because a lot of the residents there used to be farmers. So tailoring it this way may have some effect on their cognition and memory. So thank you for watching my presentation on animal-assisted interventions and their effects on dementia. And here are all of my references.